Hello, my name is Jane Cummings. I am so grateful to have this opportunity to mark International Nurses Day and International Day of the Midwife. Nurses and midwives do an exceptional job all year round and are vital in not only helping the health and care system meet the increasing and changing needs of our patients today, but also in developing and delivering an NHS and care system that will be fit for the future. This year marks a historical significant moment for nursing. Many of you will know that this is the centenary of the execution of Edith Cavell. Edith Cavell was a British nurse who worked during the First World War. She saved soldiers from each side of the conflict, and she is famously quoted as saying, "I can't stop where there are lives to be saved." Edith Cavell is celebrated for saving the lives of soldiers on both sides without discrimination, and she helped some 200 Allied soldiers escape from the German-occupied Belgium. For this, she was arrested, she was court-martialed, she was found guilty of treason, and she was subsequently sentenced to death. We have plans in this country to celebrate that and to mark her centenary with a £5 coin bearing her image. Another very well-known nursing figure who I'd like to take a few moments to discuss is Mary Seacole. We have got ongoing plans to erect a statue of Mary Seacole in the grounds of St Thomas's Hospital in London. This has been in the process for some time, and funds have been raised over many months to be able to achieve that ambition. Mary's courage and compassion as a nurse were able to provide soldiers with food, care and a dispensary during the 19th century Crimean War. This will also be the very first statue to a named black woman in the UK. And you can find out more by looking on Twitter and following the @SeacoleStatue hashtag. But of course, ultimately, we mark International Nurses Day on May the 12th because it is the birthday of Florence Nightingale. Her pioneering work on the quality of care, sanitation, training and research is not only the historical background to the modern nursing profession, but continues to be at its core. I think it's probably sensible and important to say that the work of Florence Nightingale, Edith Cavell and Mary Seacole were the early pioneers of the 6 Cs. Many of you will know what they are, but in case you don't, I will repeat them. They are care, compassion, communication, competence, courage and commitment. The 6 Cs have been adopted throughout the country and now in some cases overseas, which is just fabulous to see. Since last year's International Nurses Day, we have seen quite a few changes. This includes the NHS 5-year forward view, Health Education England's Shape of Caring review, and the revised NMC code. I would like to say a few words about each of these. For nurses and midwives, the 5-year forward view will see our skills and expertise increasingly recognised and used to support patients in a range of settings. It would be important for us as a professional group to work on the new models of care and to continue to provide compassionate, safe and consistent care wherever that care is given. The 5-year forward view also focuses on the importance of preventing ill health and promoting health and well-being. This is the first time for many years that we've spent such a big focus on how to look after ill health and how to prevent that ill health happening in the first place. It recognises the vital importance of working with patients and our communities and in our role in delivering those new models of care. We will increasingly work in partnership with patients, with communities and across teams and organisations in the health and care system to deliver the improvements, behaviour change, innovation and efficiencies in care locally. Our work, as I've said, will support the health and well-being of the public, both in prevention and health improvement. We need to improve efficiency and we should help and enable people to manage long-term conditions and to be able to enable them to stay in their own homes. For many patients I speak to, for family and friends, that's what they want. They want to be cared for as close to home as possible and ultimately in their own homes. But the 5-year forward view also highlights the challenges we face, which makes the Shape of Caring review timely. It is absolutely vital that we invest in consistently high quality education and training for nurses and midwives and care assistants, equipping them to deliver compassionate, competent and person-centred care in a changing environment. The recently relaunched NMC Code is built around the 4 fundamentals of care which patients have told us they expect. These are to prioritise people, to practice effectively, to preserve safety and to promote professionalism and trust. On my visits around the country to a variety of care settings and universities, and the contact I have through both Twitter and all the other examples of spending time with nurses, midwives and care staff, I am constantly presented with examples of how you all work together and show those principles, live those principles of the 4 Ps together with the 6 Cs. This contact also means I see at first hand the pressures and challenges that nurses, midwives and care staff face on a daily basis, together with their wider clinical teams. I'm always overwhelmed by your determination to do the very best for patients despite this, and to look at how you can work innovatively and together to actually deal with some of those challenges. Occasions such as International Nurses Day and International Day of the Midwife are an opportunity to reflect, to celebrate and to encourage. The past year has brought a number of developments which will set the tone for the future. Reflecting on these developments gives us an opportunity to celebrate all we have achieved, all you have achieved, and encourage each other to build on this for the benefits of our teams, our patients, and our communities whom we are privileged to serve. Thank you for everything you do, and I look forward to continuing to work with you in the future. Thank you very much.